Hello all, this is Mrs.Lalithamani, professor from SNS College of Nursing. In this lecture series, in this season, we are going to learn about the renal transplantation and everything about the particular topic. So when we handle a patient who is with renal disorders, we need to know what is going to happen. If at all there is a transplant, where how the donor kidney will be received and how the recipient, where it will be placed. So in this lecture series, we are going to learn about the kidney transplant provides better long-term survival and improved quality of life. So we are aware that the patient who is getting the renal or any organ transplant will have a survival rate, and if the transplant goes in for a success, it has been progressively improving the years. Following years, it has been progressively improving. So earlier the rate and prognosis of the transplant was very minimal, but nowadays it is being improving. The kidney transplant is a treatment for end stage coronal ESRD, that is end stage renal disease or end stage kidney disease, ESKD or ESRD. So when we talk about an organ donation, we need to understand that it is the process of surgically removing an organ or tissue from one person. He may be called as an organ donor, and placing it to another person called as a recipient. So an organ donation is the process of surgically removing an organ or tissue from one person, the organ donor, and placing it to another person. So it may be any organ that can be provided from one person to another patient. So what organs and tissues can be transplanted? So nowadays the transplant is becoming more gaining more support from the family members, because when a person is becoming a donor, it is not only that the patient himself with the consciousness the organs will be donated, like blood donation, it is also a cadaver donation also. So the organs and tissues that can be transplanted include liver, kidney, pancreas, heart, lung, middle ear, skin, bone marrow, heart valves, connective tissue, vascularized composite allografts, that's the graft or the tissues, and transplant of several structures that may include skin, bone, muscles, blood vessels, nerves, and connective tissues. So the organs has a wide range of scope, where all these can be a donor, which can donor organ from one person, and it can be entering into the another person body, that is a recipient body, as a donor organ. So nowadays we are able to understand that the people who are the becoming the family members or the organ donor sensitize the people or the family member and how to go in for this organ donation. So when this organ and tissues are being transplanted, this will be increasing the patient or somebody who is in need of an organ, so that they can survive for a longer duration. So in this topic we will be learning about the kidney transplantation. We know that there are two kidneys on the right and left. In the flank region normally it will be placed, but when the kidneys are being in a failure stage, that is end stage renal disease or end stage kidney disease, the nephrectomy might not be done, and in all cases the nephrectomy might not be done. But a donor kidney can't be replaced in the usual position or the normal position, but the kidney can be placed in the pelvic brim. So when this pelvic brim is taking up the role of a donor site or anchor, we can call it as an anchoring site, where this will be supporting the kidney which is being received by a recipient patient, or when the kidney is being donated by the donor. So the donor site or the site of placement of a kidney after a transplant will be the either side of the pelvic brim. So we can understand that the kidneys, though it is being collected, though it's being harvested from the donor, it will not be placed as like a normal position or normal in the anatomical position, but in this case this will be acting in a place of pelvic brim. So that will be the site for the donor thing. So until then, now we have seen about what are the organs to be transplanted, what is the role of transplantation now, and a few content introduction about the renal transplant. Until we meet in the next slide, thank you for your patience listening. So renal transplant, it will be continued in the next few slides. Thank you so much.